Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 13th topic. Method of Occlusal Equilibration. 13. Method of Occlusal Equilibration. Occlusal equilibration is performed based on the following procedure. 1. Occlusal analysis and diagnosis using models. 2. Elimination of Senrich relation occlusal interference. 3. Elimination of mandibular lateral occlusal interference. 4. Elimination of mandibular anterior occlusal interference. 5. Harmonization of anterior occlusal guidance. Each will be explained. 1. Occlusal analysis and diagnosis using models. When the location of malocclusion is clearly defined, treatment may be completed solely through oral examination and occlusal equilibrations. However, typically, occlusal analysis and diagnosis require the use of models mounted on a semi-adjustable articulator. This is especially true for extensive malocclusions where patients complain of not knowing where to bite, malocclusions following orthodontic treatment, malocclusions after placement of large crown restorations, and malocclusions developing after implant superstructure placement. In these cases, establishing clear treatment goals through occlusal analysis and diagnosis using diagnostic models, along with simulated occlusal equilibrations, is indispensable. 2. Elimination of Senrich relation occlusal interference. The removal of Senrich relation occlusal interference is performed based on the procedure outlined below. A. Guiding the mandible to Senrich relation. B. Confirming Senrich relation occlusal interferences. C. Explaining Senrich relation to the patient. D. Confirming Senrich occlusal interference areas using articulating paper. E. Grinding down occlusal interference areas. F. Confirming the post-adjustment occlusal sensation with the patient. Each step will be explained. A. Guiding the mandible to Senrich relation. First, the mandible is guided to its Senrich relation through bilateral manipulation. B. Confirming Senrich relation occlusal interferences. When guiding the mandible to its Senrich relation, ask the patient which side touches first, the right or the left? By asking this question, you can predict the approximate location of occlusal interference. C. Explaining Senrich relation to the patient. After guiding the mandible to Senrich relation while performing mandibular hinge movement, the practitioner informs the patient this position of the lower jaw is the most advantageous natural position for the joint. By helping the patient understand Senrich relation in this manner, guiding to Senrich relation becomes easier, and the detection of interference becomes more accurate. Consequently, appropriate occlusal adjustment becomes possible. D. Confirming Senrich occlusal interference areas using articulating paper. Using bite registration paper, record the occlusal interference in Senrich relation. As shown in the model in the right photograph, occlusal interference in Senrich relation is observed at the mesial marginal ridge of the upper left fore. E. Grinding down occlusal interference areas. Occlusal interference areas marked with bite paper shall be reduced in accordance with the principles of occlusal adjustment, outlined below. Eliminating occlusal interference in centric relation takes precedence over all other occlusal adjustments. 1. For cusp-fossa pairs, reduce the fossa. 2. For functional cusp versus non-functional cusp pairs, reduce the non-functional cusp. 3. For functional cusp versus functional cusp, select the side that does not affect the vertical dimension of occlusion for reduction. 4. For incisal edge versus lingual surface, reduce the lingual surface. 5. For incisal edge versus incisal edge, select the side that does not affect aesthetics for reduction. F. Confirming the post-adjustment occlusal sensation with the patient. The black areas on the upper right model indicate where occlusal interference was removed through reduction. After performing occlusal adjustment, ask the patient, "Has your bite changed?" If the patient answers no change or it has worsened, further occlusal analysis and diagnosis are necessary. When occlusal analysis/diagnosis and occlusal adjustment are performed appropriately, the patient will respond, "My bite feels more comfortable." This communication with the patient allows confirmation of the treatment's effectiveness. 3. Elimination of mandibular lateral occlusal interference. Next, as shown in the photo on the right, eliminate occlusal interference in the mandibular lateral position. The removal of occlusal interference in the mandibular lateral position is performed based on the procedure outlined below. A. Guiding the mandible to lateral limit position. B. Elimination of occlusal interference on the balanced side. C. Elimination of occlusal interference on the working side. Each will be explained. A. Guiding the mandible to lateral limit position. To guide the mandible to the lateral limit position, as shown in the upper right diagram, the operator's thumb is removed from the chin and both hands guide the mandible laterally. Guiding healthy individuals into this mandibular lateral limit movement is not particularly difficult. However, guiding patients with malocclusion into the mandibular lateral limit position is extremely difficult due to factors such as tension in the masticatory muscles and improper mandibular movement habits caused by malocclusion. Therefore, patient instruction is necessary. B. Elimination of occlusal interference on the balanced side. Once the mandible is guided into a lateral position, gently bring the upper and lower teeth into contact. At this stage, if the working side canine and molars are not making contact, suspect occlusal interference on the opposite side, as shown in the right-hand diagram. Insert bite paper between the molars on the opposite side to identify the site of occlusal interference. B. Elimination of occlusal interference on the balanced side. When occlusal interference is present on the balanced side, remove material until the working side canine can make contact. Since the contact point of this occlusal interference becomes a functional cusps on both the maxillary and mandibular arches, careful occlusal adjustment is necessary to avoid reducing the occlusal height. At this stage, only one side should be reduced. Do not reduce teeth on both arches simultaneously. C. Elimination of occlusal interference on the working side. As shown in the illustration above right, if the mandible is guided in a mandibular lateral direction and the working side canine does not contact while no occlusal interference is observed on the balanced side molar, suspect occlusal interference on the working side molar. Confirm the location of occlusal interference by interposing occlusal paper on the working side molar and reduce the non-functional cusp area causing the interference. C. Elimination of occlusal interference on the working side. As shown in the illustration above right, perform occlusal adjustment by reducing the occlusal interference area on the lingual cusp medial slope of the mandibular molar or the buccal cusp medial slope of the maxillary molar. This ensures proper occlusal guidance for the working side anterior teeth. This occlusal interference occurs when the non-functional cusp of the working side molar is excessively high. 4. Elimination of mandibular anterior occlusal interference. Next, we eliminate occlusal interference in the mandibular protrusion position. When occlusal interference exists in the mandibular protrusion position, as shown in the illustration on the right, the molars make strong contact while the anterior teeth do not contact when the mandible is protruded forward. The patient complains that they cannot bite through noodles with their front teeth. 4. Elimination of mandibular anterior occlusal interference. When mandibular protrusion occlusal interference is present, identify the molar occlusal interference points and reduce them. As shown in the illustration on the right, reduce the occlusal interference points until the front teeth make contact when the patient protrudes the mandible forward. 5. Harmonization of anterior occlusal guidance. Finally, check the harmony of the anterior occlusal guidance. The right dental chart shows the ideal occlusal guidance pattern. While this pattern is difficult to directly apply to a patient through occlusal adjustment, it can serve as a reference when constructing the patient's occlusion. Allow the patient to freely move their mandible and observe the movement to identify any directions they unconsciously avoid, unnatural movements, or the presence of catches. Next, insert bite paper between the upper and lower teeth to replicate the movement, identify areas of occlusal interference, and then reduce and polish those areas. Standard occlusion theory for TMD. 13. Method of occlusal equilibration is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 14. Occlusal plane.